Well, good afternoon, everybody. Welcome to this month's Community Transformation Monthly webinar. I'm Simon Fielding, one of the communications officers on the Community Transformation team, and I'm delighted to be joined today by Dr. Bree McDonald and Dr. Brian Saltz. So we're going to be going through the subject of developing a specialist pathway for people with complex emotional needs. So welcome. Nice to have you with us. Just wanted to run through a bit of housekeeping before we get underway. To turn on live captions, which is possible through this webinar, click on the three dots on the bottom right-hand side of the screen. We will have 15 minutes for questions and answers at the end, so you can submit anything that you want to ask into the Q&A box at the bottom of your screen as well. We have disabled all cameras and microphones for the duration of the webinar, so if you do want to get in touch, again, use the Q&A box as mentioned previously. And we are recording this as well. It's going to be added to the Community Transformation YouTube playlist once we've finished. A summary of the topics covered in the webinar will also be emailed to participants this afternoon. And we also ask as well if you could complete a short survey emailed to you to let us know what you think of the webinar and how we could potentially make it better in the future as well. So a quick look back on what we've covered so far then in the world of community transformation. Looking back at November, we did that background about the transformation of community mental health services for adults and older adults in Sussex. Then in December, very much looked at the development of the emotional wellbeing service. And January, very much a focus ahead to 2023. And in February, we looked at developing the all-age eating disorders pathway. So if you missed any of those, you can watch back previous webinars by scanning the QR code that is on the screen now, or going to the Community Transformation playlist on YouTube. So the agenda for today then, I'm going to hand over to Bree and Brian in a moment to do some introductions, but we're really going to be focusing on what are complex emotional and relational needs, including personality disorders, looking at a few short videos as well. Bree's going to then talk a bit about why we need to develop, or what we need to develop in Sussex to show that we are transforming the care that we offer. And we'll also look at a visualisation of the care pathway that we are developing together with the Sussex-wide steering group. Also important as well to work with our partners in the voluntary sector. We'll go into a bit of detail on that, and also hear from people with lived experience about how they are helping us to co-produce and co-design our care pathway. So it's going to be an interesting 45 minutes or so, and also looking at how you can get involved as well. Going to now invite Bree and Brian onto the screen and talk a little bit about the start of the presentation, looking into complex emotional and relational needs. Bree and Brian.
Thank you, Simon, and thank you for asking us to do a bit of an update from the Complex Emotional Needs Steering Group. I'm Brian Saltz. I'm the lead psychologist for Brighton and Hove, and with Bree and Martin Packwood from NHS Sussex Commissioning, we co-chair the Complex Emotional Needs Steering Group.
I'm Bree McDonald, and I'm the professional lead for psychology and psychological therapy in West Sussex, and as Brian said, co-chair the steering group with Martin.
Just to kind of orientate us a bit about the sort of people that we're thinking about who, you know, in essence require a transformed care pathway across Sussex. We call our population complex emotional relational needs, and you'll notice in brackets it says including personality disorders. We're going to play a clip from the Royal College of Psychiatry defining personality disorders. But before we get going with that, just really important to say there's no ideal terminology that describes the complexity of need, sometimes the severity of need that gets attached to some of the people who end up with a diagnosis of personality disorder. We prefer complex emotional needs because it's less stigmatizing. PD carries huge amounts of social stigma. And also we're trying to redefine our pathways as not rejecting, as welcoming of complexity, and thinking about more of the current evidence-based treatments that actually improve people's lives. And that, for us, is what transformation is about. So we'll play a little bit of a clip just so that we know who we're thinking about.
Your personality is all the ways that you think, feel and behave. It's what makes you an individual. A great deal of our personality develops in childhood, where we learn how to deal with stress and form healthy relationships. But if we suffered adversity or abuse as children, we can grow up without healthy ways to handle stress or to get on with others. For some people, this can cause them to develop a personality disorder. Personality disorders are fairly common and affect about 1 in 10 of us, though many aren't that severe. If you have a personality disorder, you may do things without thinking and find it hard to control your emotions. You may find it difficult to make and keep relationships. You feel bad about yourself and may self-harm. You may mistrust other people or hear voices when stressed. You might struggle to control your feelings or behaviour, and this can get you into trouble. Talking to a psychiatrist or therapist can help you learn ways to manage your emotions and behaviour. It's very important to keep in regular contact with support services. There are also lots of ways you can help yourself. Hobbies and interests will help you handle stress. Anything from knitting to reading to watching football, whatever you enjoy. Exercise is a great stress reliever, even if it's just a short walk once a day. Stay away from heavy drinking or drugs. After the short-term relief, they actually end up making things much harder to handle. If you're working with a mental health team, make sure you stick to your treatment plan. They'll help you find better ways of coping. Remember, personality disorders are common. Many people have them and still live happy, healthy lives. To find out more about personality disorders, visit the Royal College of Psychiatrists website.
Thank you. And just to kind of do a little bit of a summary of some of the key areas I like to think about when I'm thinking about someone who may present to us with complexity, I sort of think about the affective or the emotional part of their lives, the feeling alone, sad, quick to get angry, so-called mood swings, the cognitive aspects, that people who, when very stressed, start to feel the world maybe against them. There's often dissociation, often people who think they're bad or evil all of the time. Then the impulsive kind of segment, people who hurt themselves, may not want to exist, and do things that might be labelled as damaging, impulsive acts. And then finally, really, for me, the interesting sort of bit about the interpersonal, people who really struggle to manage the relationships in their world and that sort of push-pull sort of dynamic that can happen, but also the panic for people when they feel they're going to be left alone. Thank you. Next slide.
So we wanted to share with you today the things that we've been asked to develop in Sussex and the work that we've been asked to do. We've been asked nationally through transformation to follow a process so that we can achieve this list on this style, on this slide, but also to use the principles on this slide to inform the work that we do. So first of all, we need to put together a dedicated pathway of care that crosses all of our services and means that we're working in a collaborative way and with a biopsychosocial framework. We need to be sharing our skills, so we need to be offering consultation and support where we have it, supervision and training, especially to generic services, our partners in the voluntary care sector and primary care services. All of this work needs to be co-produced right from the beginning, from design until the delivery of each service as it comes into being, alongside people with lived experience, recognising those sensitivities as well. And as part of that, we also need to be having people with lived experience in paid roles across our services at every level. We need to be making sure that we have timely access to evidence-based psychological therapies, as that is the mainstay of interventions for people with complex emotional needs, and also offers real alternatives to hospital-based care, which is largely not recommended for people with these complexities. We need to support our staff in all of our different services to access continuing professional development and to take up the training opportunities that are around for us at the moment within the transformation agenda. And we need to be providing care for coexisting needs alongside complex emotional needs as well. And everything needs to be done in a compassionate and trauma-informed ethos. And today in our webinar, we're going to be talking about some of the work that we have done already, some of the work that we're doing at the moment, and our vision for the future around this pathway. And we've got some examples to show you of that work as well. Next slide, please.
So what we've tried to do with this slide is do a bit of a visualization of the pathway that we want to create, and to a certain extent some of this work is happening already. At the bottom of the pyramid you'll see we have our society, our community, the kind of the shops we go to, the libraries we go to, etc. That kind of open access to community support that's trauma-informed and non-stigmatizing. And I always like to think about enabling people to feel they have a life worth living, relationships worth having, a home and a sense of belonging. So in this sort of ideal world, people who feel they belong. At the next layer up, we start to think about targeted mental health support around some of the needs. And this largely fits within our emotional wellbeing services. And we've got a couple of people who'll be talking about that later on one of our video clips. At this area, as Bree was saying earlier, we're also thinking about how we share the skills from our dedicated kind of trained staff. So the idea at this level is supervision, consultation and training for people's GPs, for our voluntary sector partners, for housing staff who are keeping people safe 24 hours a day. And examples of kind of interventions that we'd be thinking about would be the emotion management groups and what we call PICT, psychologically informed consultation and training. If we go one more layer up on the pyramid, we're thinking about the dedicated pathway. We're thinking about our acute and community multidisciplinary teams trained to work not just with each other, but trained to put the person at the centre of the care that we're delivering. And one of the things that we are rolling out across Sussex, which we'll come back to talk about later, is structured clinical management, which we want to see as one of the bedrocks of treatments across Sussex in our communities. And then finally, we've got some examples of what we call intensive community treatments. And that's where an evidence-based treatment such as MBT or mentalisation-based therapy gets embedded with people who are at an additional layer of complexity. And the really important thing about this diagram are the arrows running up and down. And this is about what we call the service user networks or the SUN groups. And this is the partnership of experts by experience together with experts by training, offering low threshold groups to enable people to access support across the week as and when they need them. Next slide, please.
So this slide fleshes out a little bit more what Brian's just been talking about and talks a little bit more about the pathway document that we need to produce together in collaboration with other services and is in draft form at the moment. And just tells you a little bit more about what those different levels of care mean and examples of services within them. So we've got 3 or 4 tiers that we're working in to describe and to explain at the moment. And some of the feedback we've had already actually from our experts by experience and our voluntary care sector partners is that maybe tiers is more of a service language and we need to rethink that particular language. And for the purposes of today, we're going to stick with tiers, but we are thinking about that. So Tier 0 is our kind of open access to all. So the kind of things in our communities that we can use and pick up without any kind of referral. So going to our GP service, our primary care networks, the support that we might get in colleges and churches and schools, local authority provision, social prescribing, families, the kind of interests and hobbies that might be around in our communities. Tier 1 is that more targeted mental health support that's largely still open access, but it's more targeted to maybe specific distress or experiences that you might be having. And that includes referral to our NHS talking therapy services, which have slightly different names in our different places across Sussex, and also accessible help for service users and referrers and carers into our emotional wellbeing services. And Jenny Edge in a moment with Emma Logie is going to talk a little bit more about some of the more specifics around the roles and interventions that we're building on this pathway at the moment in the emotional wellbeing services. Then in Tier 2, we have our multidisciplinary acute and community teams receiving referrals from different parts of the service, including our assessment and treatment teams and some specialist teams that again are slightly different across the patch. And Tier 3, our dedicated pathway that Brian mentioned. So our 3 services really, Thinking Well in East Sussex, Lighthouse in Brighton and Hove, Bluebell in West Sussex, offering that dedicated specialist MBT, mentalisation-based therapy, either one-to-one or group intervention, slightly longer intervention, really comprehensive for people who have more complex needs. And I guess the important thing about the way we're writing and visualising and pulling this pathway together is that we also need to consider how people can move easily from one service or tier to another, and also that we have examples of where it's the same across Sussex and examples of services where there's a different. Next slide, please.
So now it's my pleasure to introduce a little video which Emma Logie, who is our Voluntary Community Social Enterprise VCSE Transformation Lead for West Sussex. And she's going to be talking with Jenny Edge, who's our General Manager for our Emotional Wellbeing Services. Thank you.
Hi there, my name's Emma Logie and I have a shared role in West Sussex as VCSE Transformation Systems Lead, but I'm also one of the senior managers at BHT Sussex, overseeing our West Sussex mental health support services, including Pathfinder and the emotional wellbeing services for Mid Sussex and for Crawley.
Hi everyone, I'm Jenny Edge. I'm the General Manager of the Emotional Wellbeing Service across Sussex, employed by Sussex Partnership, working alongside Emma and other partners in the EWS.
We're here today just to give you a bit of an overview of the Emotional Wellbeing Service in Sussex. The service is co-produced by a number of VCSE organisations, SPFT and the PCNs across Sussex. You would have seen their logos just now on the slide previously. The Emotional Wellbeing Service is for patients 18 years or over that frequently use appointments for support with their mental health. It provides focused, short-term sessions for patients which are easy to access through their local GP surgery. The service is open for all patients with mental health needs that do not currently have access to mental health support, as either they do not meet the criteria for services or it does not meet their needs. This includes people with complex emotional needs. This model of service has already been delivered in some areas of West Sussex since 2019. Now I'll hand you over to Jenny.
Thanks, Emma. And just to kind of build on the picture that Emma's just created for you, we've now got the Emotional Wellbeing Service live in a number of primary care networks across Sussex. So in West Sussex, we have 21 PCNs and we're live in 19 out of those 21. In Brighton and Hove, we have 6 primary care networks and we're live in 4 out of those 6. In East Sussex, we have 12 primary care networks and we're live in 4 out of those 12. So just to give you an idea, across Sussex, we've got a total of 39 primary care networks, and we're live with an emotional wellbeing service, as Emma's just described, in 27 out of those 39. And just to give you a little bit more detail about the roles that we have in the emotional wellbeing service, we've got a voluntary sector mental health support coordinator role, and each primary care network has one or two of those roles, and working alongside them is a Sussex Partnership mental health practitioner role. So what the EWS is able to provide is responsive and accessible mental health support in GP practices, and it's got direct access to mental health clinical support alongside. They're able to offer advice, information and supported signposting, targeted one-to-one and group work, and particularly thinking about people with complex emotional needs, we have a 5 Ways to Wellbeing emotion management group and individual workshops that we're delivering in the emotional wellbeing service. And we've been supported in the development of that group by a peer support worker who also has lived experience of complex emotional needs, and also supports in the delivery of that group. The EWS
Pathfinder and the emotional well.
EWS is able to provide is responsive and accessible mental health support in GP practices, and it's got direct access to mental health clinical support alongside. They're able to offer advice, information and supported signposting, targeted one-to-one and group work, and particularly thinking about people with complex emotional needs, we have a 5 Ways to Wellbeing emotion management group and individual workshops that we're delivering in the emotional wellbeing service. And we've been supported in the development of that group by a peer support worker who also has lived experience of complex emotional needs, and also supports in the delivery of that group. The EWS is also able to provide a bridge to mental health support and other community services that people can access, and it provides that direct access to the Sussex Partnership mental health practitioner, so they can provide consultation, clinical support, and also direct referral from the mental health support coordinator. And there's also liaison provided with Sussex Partnership Services, and also step-up referral if that's required for people into SPFT specialist services. And the future plans will be to extend the emotional wellbeing service to include psychological practitioner roles, providing short-term evidence-based interventions for people with complex emotional needs, and also to introduce consultation using the PICT model with specialist psychologists.
Thank you. So now we've thought about that next layer up in the pyramid, we're going to talk now and think about the tier 2 and 3. And this model, structured clinical management, is an evidence-based, well-researched approach that enables mental health teams to work more effectively with people with complex emotional needs. It's a low entry threshold into teams. It's all about engagement. It's attachment-based and relational. It's evidence-based prescribing and good psychoeducation. Really importantly, it's about developing a relationship so you can develop a collaborative care plan, collaborative risk and safety plan. Structured clinical management is a set of evidence-based principles, it's ways of working and skills building. It's about the bedrock being treatment in the community, but importantly, it reaches across our whole system, community, urgent care, inpatient, so that we can all start using the same theories and the same language, no matter where somebody is within their kind of care needs system.
Thank you, Brian. And this next slide is just to emphasise that this is for everybody, all of our staff in our community teams, both in adult and in older adult. And we've also started some work in thinking about how SCM would look in our acute services. So all professions are involved, and experts by experience, peer workers. This is a multidisciplinary approach. It's a way of, it's a culture of doing things, it's best practice, as well as being an intervention as well. So our vision is that everybody in our community teams could be trained in structured clinical management, and we've done lots of that training already, and also that we might be offering some conversations with other parts of the service, such as our voluntary care sector partners, around what structured clinical management is. There's a knowledge across the system about this bedrock intervention.
And just to say thank you to Emma Smith, West Sussex, Deirdre Fuller, Lucy Chambers in Brighton and Hove, Emma Clifford and Gillian Irving Quinn for the work they're already doing to enable this to become embedded in our dedicated community mental health teams.
Thank you. Next slide, please. I just want to introduce Charlie Adams O'Shea, who's an expert by experience, who's been working with us alongside Juliet Casbolt in the West Sussex pathway work for the last couple of years, and more recently in the steering group across Sussex. And Charlie is just going to talk a little bit about what that experience has been like working with us, co-producing and co-designing this pathway, and give some examples of some of the work that her and Juliet have led on, which has brought the service user perspective right to the heart of the work that we're doing.
Hi, I'm Charlie, and myself and my colleague Juliet have been working on the complex emotional difficulties pathway since the very beginning, which has been an absolute honour, to be honest. As an EBE on the pathway, or expert by experience, it's been so important for me to be able to share my voice with the people who are developing the pathway and really make sure that the service users are at the heart of everything that we do. So I've made sure that in our implementation meetings, I've been very vocal about what's been being said, if I can offer any suggestions or anything like that, to kind of shift discussions and change perspectives of other people, because I think it's really difficult sometimes, because you can lose your focus and get so caught up in the work that you're forgetting who this work is for, and it's for us as service users. It's also been really exciting for me because as a person with complex emotional difficulties, I've been on the pathway that this will be replacing. So for me, it was really exciting to get so involved and be able to really help direct and shape this new pathway. So myself and Juliet, we worked together with Bree and Brian to create some leaflets for our service users, which will go out with their appointment letters. I came up with a letter that explained a bit about the pathway, and that it was written by myself as an expert by experience. And the real aim of this was to take away the anxiety around those appointments and reassure the service user that it's nothing to be worried about, that they can bring someone along with them if they choose to. And the purpose of the leaflet that my colleague Juliet did was, within the pathway, we offer 1 to 4 sessions initially to kind of scope out what's going on for the service user at that time, what support they might need, what do they think they might need. But there's no obligation to do those 4 sessions. So that's just, you know, a broad interest. They might get through all the criteria within the first session, so therefore they wouldn't need the other 3. But it's there just, you know, so we can really focus on the service user and really build that relationship with them, reassure them and encourage them that we are there to help them. The leaflet will be up on the screen in just a moment for you to have a quick look at. alongside doing this, we talked about running a carers group for those who care for someone with complex emotional needs or difficulties. And this was something I was really interested in helping with, not because I'm a carer, but because I do have my own lived experience. And so myself and another colleague, we have worked together to create 7 sessions, which are running currently, with the first session being an introduction to complex emotional difficulties and personality disorder. We then look at managing emotions, skills-based therapies, validation, and problem-solving skills. Now, we've only done 2 sessions so far, but the feedback has been absolutely fantastic. And it's really lovely to hear that having myself there with lived experience really adds a different level to the group, and that they can see a positive example out of such negative experiences. That, yes, I have had my own negative experiences, but now I've stepped back into the role of work. I'm now a peer support worker, as well as doing my EBE things. So it kind of inspires hope in them, which is really what we wanted to do. We wanted to wrap our arms around the carers and really make them feel that they are just as important, and to do anything we can to help them. So we've done the introduction so far, and we've done the managing emotions, and it seems to be going down really well. And it's been an absolute pleasure to be a part of the pathway. And I have no plans to kind of drop out now, because I am back in work. It's something that I'm really passionate about, and always want to be the voice of our service users, to make sure that they're getting the care that they need and they deserve. Thank you for listening.
Thank you, Charlie. And important work that we've been doing over the last 6 months of the Complex Emotional Needs Steering Group has been the development of the business case. So we thought we'd give you 4 kind of headlines of what we're going to be focusing on over the next few months. And this is the business case for the development of services across Sussex. Firstly, the implementation of service user networks will be one priority. Accessible groups led by experts by experience and experts by training in your local community, open across the whole pathway. Secondly, psychologically informed consultation and training, or the PICT services, where again, experts by experience together with experts by training in partnership provide support, consultation and supervision for our primary care network colleagues and VCSE partners. Thirdly, embedding structured clinical management across our dedicated multidisciplinary teams to provide an approach which will help shape the culture of our whole team, but also provide really significant interventions to help people manage the complexity of their condition. Finally, and this is also thanks to our commissioning colleague Martin Packwood, we're going to be doing whole system impact modelling. Our commissioner is going to be helping us understand the health economics of our communities, collecting data, measuring what we do, so that wherever you are in Sussex, we want you to receive the best care possible. Thank you. Next slide.
And as we've said during the webinar, lots of this work is at different stages. So much of it is started, some is towards being finished. But importantly, it's all been hugely collaborative. And we've really enjoyed it. And as Charlie mentioned, I think the implementation groups in our local areas and the steering group, there's a real passion and a real energy there, and lots of things going on. So if you would like to get involved, we have 3 contacts in the different areas. Sophie Atwood in Brighton and Hove, Patrick McGuinness in East Sussex, and Judith Baisley in West Sussex. And obviously Brian, myself and Martin Packwood, please do contact us for any feedback, any ideas, or if you want to get involved in any of the implementation groups. And from today, we would really, really welcome any questions, any feedback. It all helps to kind of shape the work that we're doing. So yeah, thank you very much. Next slide.
Well, thank you very much, Bree and Brian. A really useful insight there into the topic. We're going to come on to some questions in a moment. So if you do have any questions that you'd like to ask Bree and Brian this afternoon, do drop them in the Q&A box. And don't forget to join us for the next Community Transformation webinar. That's on Wednesday, the 17th of May at 12 o'clock, where we're going to be looking at the role of voluntary community and social enterprise in the community mental health transformation project. So we'll come on to some questions now, and at the moment, Bree, Brian, we don't have any questions. So a final reminder, if anybody would like to ask a question, do drop it in the Q&A box, and we hope that you found the content in the webinar today useful. Bree, Brian, it's really interesting, isn't it, to hear some of the personal stories. And again, that's a real big focus of the work that you do involving service users.
I think that's been one of both the most enjoyable parts of the work, but also is producing probably some of the richest and most useful parts of the work that we're doing, both in terms of working with people with lived experience, but also the work with our partners in Sussex and the different agencies, different people coming together, different perspectives, really co-producing and shaping the work. So yeah, it's a very positive part of the work.
And I mean, in some ways, if we don't have people who use our services helping us redesign our services, then actually we lose the opportunity to really make a difference across Sussex.
Brilliant. Well, we don't have any questions. It's always a sign of a good webinar, I think, if we don't have any questions. I think all the questions, all the topics there that people wanted answers to are covered. Having said that, we just had a question come in, so right on cue. Got a question here about how an EBE would get involved. If they're heavily interested and would like to know a bit more, there's a question here about they're mostly very positive of the future with Sussex Partnership. So how would people get involved if they wanted to help out?
Well, they could certainly contact us through the emails that have been part of the presentation, but that would be really linking them up with our fantastic people participation services. So please do send us your details and we'll sort that out for you.
Brilliant. Yeah, I think there's a lot of interest for getting people more involved in sort of the services and the EBE work there. So yes, do get in contact with the contacts at the end of the slide there, and we can share the slides afterwards as well, so you've got those contact details as well. Don't think there's any more questions that have come in since we answered that one. But so just want to reiterate, Bree and Brian, thank you very much for joining us this afternoon. It's been a really, really useful topic to discuss, and some really interesting personal stories as well.
Thank you very much, Simon.
Thanks, Simon.
Lovely. And don't forget to join us for the next webinar, the 17th of May. We'll see you then. Thank you very much for joining us.